Welcome back to Healthy Living. So with me now is Brian Grissom. Brian is the Director of Anesthesia at the St. Tammany Health System Surgery Center, and he is going to continue our conversation about our new leading edge facility that is slated to open in early March. So welcome, Brian. Thanks for being with us.
Nice to be here. Thanks for having me.
Good. So it looks like I also did a little digging on you. It looks like you're going to be with the health system 17 years this April.
Yep.
So congratulations on that.
Thank
Tell
you.
people a little bit about your background, what you've been doing with us for that time.
Well, for that period of time, I've been a staff nurse anesthetist here at St. Tammany. I've been in a lead or director role with the anesthesia department now for probably 6 or 7 years. So.
All right. So I have seen you in action at the surgery center, you and Amy both. I've been on a tour with you through the surgery center, and it is a fantastic, leading edge doesn't even begin to describe the facility.
Yeah.
So tell our guests, our watchers, an overview of the new facility and what they can expect if they need to come there for surgery. What can they expect?
Yeah, so I think, you touched on a little bit of it with Amy, but it is a 126,000 square foot facility. We're going to have 12 operating rooms in the facility. There are 24 private pre-op bays in the facility, all with private bathrooms. So the experience of coming to the facility and getting ready for surgery is certainly going to be second to none. There are 18 post-anesthesia care bays as well for your recovery, and those are also private, which not too many facilities have private recovery rooms, but we do there at that facility. We're going to treat a wide variety of patients there: pediatric and adult general surgery, ENT, orthopedics, urology, hand surgery, podiatry, and plastic surgery. Ortho, I don't know if I mentioned ortho, but we'll be treating a wide variety of patients there for sure.
So, go on.
Yeah, the patients we'll be treating will include patients that require 23-hour observation. We'll be doing outpatient surgery there as well as patients that require 23-hour observation. There's a 15-bed unit upstairs that patients will be, able to spend the night if their surgeon or if they decide that that's something that they need.
So somebody's going to be on staff 24 hours a day?
Yeah, 24 hours a day. We'll have nurses upstairs with the patients. Anytime a patient's in the facility, we will have anesthesia services in-house with those patients. Basically, those patients will be going upstairs as part of an extended recovery period. It's not to treat patients medically, but we'll be watching those patients for post-surgical complications as well as potentially some anesthesia side effects we'll be watching for as well.
So we talked a little bit with Amy about some of the features that are safety features, but what are some of the features that make us one of the most actually leading edge facility in the Gulf South? Because there's specific things that I remember you talking about, like the size of the operating room, for example. What are some of those features? Well,
certainly the size of the facility, the pre-op bays, the post-op bays, the size of the operating rooms, but primarily what makes us so cutting edge is the technology. I mean, we spared no expense with the technology that we put into the place. We have the most advanced anesthesia machines on the market today. We have the most advanced robotic systems on the market today, the Da Vinci robot system, the Mako robot system for orthopedics. Not many facilities have the advanced technology that we have there at the surgery center. So,
well, one of the areas that I was particularly fascinated by, which I can't go in anymore because it's off limits to civilians like me, but the sterile core and the sterile processing area, which is really important to surgery.
It is.
When it comes to the instrumentation. So can you talk a little bit about that?
Well, the sterile processing department there is certainly second to none. We bought all of the latest and greatest technology when it comes to that. You mentioned the indigo blue lighting. The sterile core also has the indigo blue lighting as well as some of the most advanced cart washers and machines that process sterile equipment for the operating room.
So what is sterile processing? Can you just tell folks? Because I didn't really realize until I was looking at it. I mean, I knew what it was, but you don't really realize until you see it.
Right. So it's the area in which we take all of the instruments that have been used on previous surgical procedures and process them, getting them ready for the next procedure, as well as the area that we take in implants and things that will be used in surgery, and process those implants that are brought in from outside vendors. So.
Okay, so very important to everyone's safety, and it's second to none.
Yep.
So anesthesiology, why is it important to have an anesthesiologist on staff 24 hours a day? And Amy touched on it. And correct me if I'm wrong, we will have a pediatric anesthesiologist on staff as well?
So we do. We have our anesthesia group. We have a fellowship-trained pediatric anesthesiologist on staff at St. Tammany Hospital. Jackie Volpe. She keeps us all up to date on the latest and greatest when it comes to the care of pediatric patients. We also have a number of very experienced pediatric CRNAs that will be working with our pediatric population there at the center.
Okay, and that is important because children are not adults, basically.
Right.
Different care.
A little bit different. They do need some different care, and there's some things we do to make the patient experience for pediatrics a positive one. And we pride ourselves in our pediatric care there at St. Tammany.
Yeah, so we talked with Amy and you a little bit about the cohesive team and the breadth of experience that will be available in the leadership roles, particularly at the surgery center. How important is that to me as a patient? Why does that even matter?
Well, I mean, you want a team that's very experienced. You want leaders there that have experience when taking care of a wide variety of patients. A team that is cohesive and works well together, and that's what we have there at St. Tammany.
Okay. So I asked Amy this, and I'm going to ask you also. Oh, wait, I want to add one more thing. Let's talk about how close we are to St. Tammany Parish Hospital, our flagship.
Right.
You know, in case you need us to be.
Most surgery centers have an affiliation with a hospital. They have a contract with a hospital that they can that they can use and depend on to provide services should the patient need services outside of what's available to be provided at the surgery center itself. We're only about 5 minutes from St. Tammany Hospital. We have a lot of support staff from St. Tammany Hospital available all the time, 24/7, for patients that are going to be in this facility. So that's a very important thing when it comes to safety of our patients.
Great. So now I'll ask you the question I asked Amy. What, as a clinical person, is your favorite thing about this facility, if you could pick one?
The technology, one, is one of my favorite things. Like I said, we have the latest and greatest anesthesia machines, the latest and greatest ultrasound machines, the latest and greatest robots. But I kind of agree with Amy. The size of the place, you know, I've worked in a lot of different operating rooms through the years, and these operating rooms are second to none. I think they're 640 square feet apiece. The technology that's in those operating rooms, the artwork in the facility, the private rooms, those are some of my favorite things. So.
All right. Anything else you want to add before we wrap up?
Well, I just want to say that, you know, if you're a patient in this area and you're looking for a first-class experience, you know, here close to home, if you're in need of surgical services, I think St. Tammany Surgery Center is the place you're going to want to come. So.
All right. Well, thank you so much for joining us, Brian. So ask your surgeon if they practice at St. Tammany Health System Surgery Center so that you can be treated there if need be. And we do want to mention that our St. Tammany Health Foundation and their Healing Arts Initiative is responsible for the beautiful artwork that both Amy and Brian were discussing. And it is located throughout the building. It's beautiful. We also have dining services in there for folks that are waiting on their loved ones when their surgeries are finished. So we have lots of different features. Please stay tuned to our website and our social media pages for more information. And thank you for joining us for this edition of Healthy Living. We'll see you next time.